Hello and welcome back to Designing Care on Air. For our second episode, we will be looking at this deep understanding of the hospital and healthcare industry from a project management lens. Today, we are welcoming Kristina Krail, who is the healthcare leader for Krail Advisory, which is a certified women business enterprise. She comes from this background as a chief nursing officer. She's been a hospital association executive and consultant. And we welcome her today to talk about operations and transition safety in a newly built environment. So, Chris, if you don't mind just describing a little bit more about your background, your education, kind of your current role in the healthcare and facility design industry.
How much time do I have?
You can have as much time as you'd like.
I started my career in nursing. I have a baccalaureate degree from William Patterson University. And very shortly after I started my clinical career, I realized I wanted to be an administrator. So I went back to school very deliberately at not a graduate nursing program, but at a school of public health. The curriculum was tailored for clinical professionals who were looking for a functional specialty like administration or public health or research or so. I finished up that degree and was fortunate enough to have a wonderful professor, Lucy Kelly, who put me in touch with the chief nurse at Long Island Jewish, who recruited me to Connecticut, where she herself just got a new job as, vice president for nursing. And as her resident, I was with her in nursing administration residency for a year, paid me the ultimate compliment, please come with me. And, let's do wonderful things together at a hospital in Connecticut. And that launched my administrative career, which then went on for the next 20 years. Until such time, I decided, let me think about consulting. I think all of us, when you start to get near the end of your career, you say, how do I take all this knowledge and experience and really not just apply it to the place I'm at, but maybe to more than one place? So I was a consultant in the financial field with a specialty in nurse staffing. And that led to getting into the design field, which was a dream job. I've always was fascinated with the built environment, the interplay of behavior and one's physical environment, and landed a job with NVBJ that, a very notable global design firm in the healthcare field. Did that for 8 years and then decided to strike out on my own with a specialty in transition and activation services.
And within transition activation services, kind of what others were talking about today, even here we are on location at the Healthcare Design Expo, not a lot of people are doing that. Can you tell me a little bit more about how you engage nurses in that component of design?
So, the design process, starts with the concept of the design. And then at the end, it turns into the building being built. When in fact, there's one more step, and that has to do with bringing that building alive through its occupants practicing within its four walls and creating those processes that are aligned with the intent of the building. A lot of logistics stuff about how do you actually get from here to there? How does that align from a schedule point of view? An inordinate amount of training. I think the biggest part of occupying a new building in the healthcare arena is that you don't have an opportunity to do it gradually or do it without patients immediately being involved. You take care of patients one day in this location and the next day in that location. And you have to be able to do it and do it safely. So there's a huge training and orientation component.
So kind of putting your nurse administration hat on, it sounds like there's a lot of change management with your staff on top of this new build component. How do you effectively manage change as nurse leadership?
I think as a nurse leader, change management is a big deal. I think that there's a variety of theories of change management. So whichever one, you embrace, the one that works the best for me is to really understand your stakeholders. Nobody likes change, but some people do thrive on it. And if you identify the people who are eager to learn about that change and run with it, those are the ones you want to engage first. You try to isolate the laggards, the people who are really adamantly not against it, and then the people in the middle. You just want to bring them along. It's that visual of who's going to stand up and sing at the picnic. And some people stand up right away, but by the time the song is over, everybody is standing up and singing. That has worked for me, whether it's involves in a transition project or any kind of, initiative with my staff.
Right. And you touched on training too. What kind of training or resources would you recommend to help bring in nursing and those other stakeholders to help facilitate their integration into this new space?
Well, I've been doing this for now over 10 years. So we've come up with, I believe, pretty reasonable formula. We don't need to teach hospital workers how to do their job that they were educated and trained to do. So I do not want to teach you how to be a nurse. You know how to be a nurse. What I need to do is orient you, and educators know the big difference between orientation, training, and education. So you need to be oriented to your new physical environment. You need to be trained on new processes and new procedures. So we run mock simulations, and those simulations are not testing the clinician's capabilities. They're drilling the clinician's ability to do what they do in a new environment. So that people shouldn't confuse those two things.
And I think a part of that is looking at changes in communication too, right? The built environment kind of changes how we work together as a team. So when you're looking at communication, a lot of what we've seen in built environment is the integration of technology. There's a lot of electronic use, tech use in spaces that can sometimes be disorienting to providers who may not be used to that, especially if you go from an older building to something that's more modernized. So what does effective communication look like now in the health design process?
That's a very good question. I don't know that I'm the exact one to answer that. I know that it needs to be multidisciplinary. It needs to leverage all kinds of modalities. It needs to be easy to use. The interesting thing is that these new technology and capabilities come about along with the new building. So it's not unusual for someone to not just have to learn how to deliver care in this new structure, but they also have to do it perhaps with a new EMR or a new, bed to patient to central station communication technology. So they're learning multiple things at once.
Yes, absolutely. And kind of taking a gander at what we've seen at Healthcare Design Expo this year, as well as in the exhibitor area. What are some technologies you're really excited about that you've seen, or some things you think may be a challenge coming up?
Well, this issue of communication is paramount. I think you were in the audience of the presentation where we looked at the open core design. And we've all worked as nurses in different floor plate configurations. And no one design is perfect. It all has its pluses and its minuses. But what struck me pretty impactfully was the comment from the awardee this morning, which said we need more research. How do we know that the racetrack configuration is a thing of the past and the open core is better? We don't know. And we really need more research in this field.
Where then can nurses intersect at that research part? How can we be involved? Because I completely agree with you that research is going to help validate or at least give us different paths to look at for industry.
I don't think that's easy for any profession or any vertical. The opportunity to find someone who's willing to compensate you for your investigative work. You have to find those opportunities. They're usually academic based. Sometimes your administration is supportive, sometimes they're not. If it's your passion and it's important, you have to seek it out.
And kind of on that note, what we've seen is it's challenging with different project settings to gain that type of different experience. How does project setting then affect your approach to healthcare facility design and leveraging the clinical nurse voice, kind of in that research vein? And then it makes me wonder, too, how your approach may change based on if you're rural or urban, for example, or if there's budget constraints where it's not one of these enormous multi-million-dollar projects we've been hearing about today.
I think nursing always has something to add. First of all, nurses can do a lot of different things. I've always said that a nurse is a little bit of a respiratory therapist, a little bit of a social worker. Sometimes they're a pharmacist. Sometimes they're, a provider. So I think no matter how big or small the opportunity is, there is an opportunity to contribute. And I think maybe because it's a female-dominated profession still, that we don't always seek out those opportunities or speak up or raise our voice the way we could or should.
Absolutely. And on that topic, what's a piece of advice or words of wisdom that you could give our listeners today from engineering, interior design, architecture, nursing? When you're evaluating systems, you're thinking about healthcare design, they're interested in what we have to say and how we could kind of help propel these design teams forward.
Well, somebody just today said, you really have to find your passion and love your work so that it's not work. It's just an enjoyable life. So, I have no trouble giving nurses advice that you can find that in nursing. Even if you've maybe in the beginning made the wrong choice about a clinical specialty or a certain, functional area of concentration, you can always change. And I bet that's true too for engineering students. And I bet that if you embrace both of those specialties and bring them together and it's your passion, then you'll really be in heaven with the career that you find in that space.
Is there anything else that you would maybe like to impart on our students or interns or our colleagues that are listening?
Again, from the speaker this morning who said, tomorrow is always going to be better than yesterday. And look forward to that because life is good. I know it's tough being a college student, but you will graduate and you will, find your life's work and it will be enjoyable.
Right. I don't think we tell them that enough. Absolutely. And this has been Elizabeth Johnson for Designing Care on Air. We thank again Kristina Krail of Krail Advisory for her insight and wisdom on not only looking at communication as it relates to the design process, but how built environment is truly an innovative space where we're integrating technologies, we're integrating all these different paths and validations and exciting new research that can come from the spaces we inhabit every day. We look forward to seeing you next time.